Okay, my name is Patricia Kitao-Ekulo, and I lead the work within the Early Childhood Development, or ECD unit, which is under the Human Development theme. Okay, we have 3 focus areas within the ECD unit. We have childcare patterns, we have integration of ECD into the healthcare system, and we have early childhood education. And through all these 3 focus areas, we seek to do various pieces of work that look at the care of young children in whichever context that they are found. Yeah. Whether it's at home or in a childcare facility or in the hospital, we are looking at different aspects of care. What we want to do is to ensure that children are receiving holistic care as they grow, and we want to provide this holistic care under 5 components, which include good health, responsive caregiving, early learning, appropriate nutrition, and then we're also looking at their safety and security. So all the different focus areas within the work that we do under the different focus areas, we look at providing care under the 5 components of the nurturing care framework. Within Africa, when you think about the aspect of care, usually it's considered the responsibility mainly of women. And I think celebrating the International Day of Care then increases the visibility of its importance in terms of the different people who should provide care for young children. And we are trying to increase recognition of the importance of children being provided for care by different members of the household. And in particular, we are trying to change the gender norms around the care of young children and have more men engaging in the care of young children. Because most of the times, the burden of care is solely the responsibility of women within the household. We are approaching the end of the period for the sustainable attainment of the Sustainable Development Goals. And one of the key SDGs is SDG 5, looking at gender equality. One of the issues that the UN has recognized is that women are kept out of the productive care economy because of the responsibilities that they have for childcare, especially responsibilities within the households. And with more women joining the labor force, there is need for more focus on ensuring that children receive the best care possible during the early years so that they can achieve optimal development. And I think it is in line with these issues that have been noted that the UN has ratified or put in place the International Day of Care so that we can increase the conversations or increase the visibility around the issues around reducing, recognizing, redistributing the burden of care within the household and in other settings. And the Day of Care was set up in recognition of the need to enhance gender equality, especially when you think about the care of young children. One of the gaps we have noted through our own research is the limited involvement of male caregivers or men in general in the issue of care of young children. And through our research, we have tried to enhance the involvement of men by ensuring that they recognize that they also have an important role to play in bringing up their young children. Most men consider, in many communities, most men consider themselves to be the primary provider, the primary breadwinner, and so they do not consider those other roles as being important to them. But we have tried to highlight that it is important for men also to be involved in the care of young children through different pieces of research that we have done in rural as well as in urban areas. In urban areas, especially in the urban informal settlements, the most important consideration that people have is how to bring, at the end of the day, how to bring in the daily bread. Opportunities may be limited because people in these settings may have low earning power because of maybe low education levels. And so when you talk to families in low-income urban informal settlements, you're likely to hear that they're struggling to bring bread. they will not really be concerned about the care of young children. And so this is the situation where you find women having to leave their children in childcare facilities which may not be of recommended quality. Because in urban informal settlements, they would like to go out and look for their daily bread, but at the same time, they do not have maybe relatives or neighbors to leave their children with. In the rural areas, you find that the social support system is still fairly solid, and if women need to leave the house, they are able to leave their young children with neighbors or members of the extended family, like grandparents or aunties, or even male relatives like uncles and brothers. Mm-hmm. So that's the difference between the urban informal settlements and the rural areas. One of the ways we engage policy stakeholders is to ensure that they're with us from the very beginning of the research. When we start to carry out the research, we make sure that we have their input into how the research should be designed and even the questions that we should be looking at. And this is based on these discussions that we've had with them about the needs in the different communities that we work within. It's important to engage policy stakeholders throughout the process so that they're part of the evidence gathering process. And in this way, they will direct the types of evidence that are required. And then also, in this way, we are able to inform the gaps in the maybe development of policies or revision and amendment of policies. One of the new projects that we're engaging in is the use of neuroimaging to capture data on children's brain function. And in this project, we want to look at the relationship or the association between caregiver-child interactions and children's brain development. In the past, measures of children's outcomes have mainly relied on behavioral measures. But with this new project, using neuroimaging scanners, we are able to track children's development over time and see actually how the brain development is progressing, and even link that to stimulation that children receive in childcare facilities. Primary caregivers have several important roles to play in the lives of young children. They are young children's first teachers because they are the ones that spend a lot of time with young children and so engage in different activities through which children can learn about the world around them. They are also the first disciplinarians. And one of the things we need to emphasize is that in our context, in the African context, caregivers believe in harsh discipline, but we are trying to change that narrative and encourage them to use positive discipline practices to ensure that even as young children grow, their safety and security is enhanced. And then the other important role that caregivers play is that they take care of the health of young children. And without good health, children will not thrive in other areas. And so it's very important for caregivers to be sensitive to the different health issues that children may be facing, and also be in a place where they can quickly make decisions about how to deal with any healthcare issues that arise. Okay, through the gender transformative parenting program, we would like to see adolescent parents get to a place where they build their confidence in the care that they provide to their young children, and also think about the best way that they can provide stimulating experiences for their young children. Sometimes adolescent parents may not have adequate education levels to know what to do with young children. And through this program, then we can provide information through regular group sessions on how best they can provide care for their young children. And I think in that way, once you build their confidence, once you build their knowledge, once you build also their expertise in taking care of young children, then they will be more confident about the decisions that they make around the care of young children in particular, and in general, the decisions within the household. Like, for example, what food should be prepared for a specific meal, or if they're bringing in an income, to the household, how that income should be used, And so those are the different ways that we're trying to enhance the capacity of the adolescent mothers. The most immediate one I can think about is the project where we worked in Nakuru looking at how to enhance the quality of childcare service provision so that women are freed to engage in productive labor processes. And we worked with the Nakuru County government, and one of the achievements that we are proud of in this project is the setting up of a Center of Excellence, which is supported by the Department of Social Services as well as a private owner. So it's like a sort of a public-private partnership where they came together to identify a space where children could be taken care of. And then the quality of service provision was also enhanced through the support of an implementing partner that we worked with. So that's one thing that I can say that I am proud of through the work that we've done. Our immediate goal as the ECD unit, we would like to carry out work that enhances outcomes, optimal outcomes for young children. That is our main focus. And in this way, we will contribute to the broader APHRC vision of transforming lives in Africa, starting with the very early years and ensuring that we are seeing children being brought up with a solid foundation, because this has an impact on the later years. When they get into school, it has an impact on their academic achievement. And even when they become adults and join the world of work, it also has an impact on the opportunities that are presented to them because of the solid foundation that they had in the early years. I am very eager to see that the work that I'm doing is contributing to positive changes in humankind. And working within the human development theme, I would like to see this contribution happening across the life course, from the very early years, in fact from conception, ensuring that even as young women prepare for pregnancy and birth, that they're being offered the best possible opportunities for the best possible pregnancy outcome. And then they are skilled and they're given the appropriate knowledge so that they can bring up children in the best way possible. And by supporting these young children, then we can say that they're also supporting future generations to enhance a wholesome society in general. Strengthening systems will foster the care of young children and ensure their optimal development.